So my topic is essentially on withdrawal of life support measures in the neuro ICU. So I can give it without the slides. So in conceptualizing this issue, there are several basic principles to get into consideration. Among those are that requesting, at least in the United States, requesting withdrawal of life support is a patient's right. I think it should be a patient's right anywhere in the world, but certainly it is so in the United States. It's also important to keep in mind that withdrawal of life support is by far the most common cause of death in any neuro ICU in the United States. And it is also very important to bear in mind that an anticipated poor prognosis is the main reason why withdrawal of care actually ends up happening, withdrawal of life support ends up happening. So it is easy to see how our prognostication can derive in the possibility of what is called the self-fulfilling prophecy, namely, I give a bad prognosis, families decide to withdraw life support, the patient dies, and that may, if I was wrong, that would have not been the outcome otherwise. That is certainly a concern, that being overly pessimistic can derive in the death of the patient that otherwise would have not happened. But it is also true that it's part of our professional responsibility to provide a prognosis that is expected by patients and families. And as I will posit to you, I would say that being overly optimistic is not necessarily the best solution because you don't want to get patients stuck in a limbo with a poor prognosis and poor quality of survival. So this is what I was telling you about. It looks very linear. It can be in certain cases. It is certainly a consideration, but in practice, we have to deal with this ghost and do the best that we can. And we still need to prognosticate, and prognostication is difficult. I